Sandi Sawchuck now from the UW School of Veterinary Medicine is here with your new friend.
Hi, Sandy.
Oh, yes, hi.
Who did you bring today?
This is Stanley.
Oh.
And he is very tired because he's been at work with me all day, and he did get vaccinated, and that can make them feel a little punky for a good 24 hours. But
how old is Stanley?
He's about 12 weeks old, we think. He's from Chicago English Bulldog Rescue. He actually came from a puppy mill in Missouri that sells to pet stores, and was born with some very defective back legs, but is now walking. And I'm continuing on with his physical therapy and planning lots of, maybe some knee surgery and things in the future for him.
He's a lucky
guy to
boy.
have you.
Oh yeah, he's a very happy little boy. So
270-9933, the number to call. Has he been microchipped yet?
He has not been, and I was planning on doing it on the air, but I went, oh, I don't want to see a puppy, you know. Okay, but it is one. The reason I wanted to bring up microchipping is this is National Pet Identification Week, and the Humane Society is doing a big promotion with doing microchipping and making ID tags, and you could probably check out their website and they'll give you all the times and things for it. But a microchip is very easy to give. I just worked at a clinic where we did a whole bunch of dogs on Saturday, and even little Chihuahuas were microchipped. And what a microchip does is it provides the dog with an individual number and ID. It's about the size of a grain of rice. I don't know if you can see that there.
The bigger it is.
Yeah, it's very tiny, and it doesn't have anything more on it than the numbers on the chip, and the dog lives with it, and it's linked to a database in a computer. So you have to keep your address up to date and so on, but dogs slip out of collars, cats slip out of collars, and it's so important to have some form of permanent identification.
And then people have to do, this is the reader, they
That's
just go scan
every
it
veterinarian and every, all the shelters and animal control agents have it, and they're able to then get the number and link it back to the database, call you and say, we have your pet.
It is so important.
It is. It really is.
All right, let's get to the phones. We'll start with Carolyn from Madison. Hi, Carolyn.
Hello.
Hi, which question?
My question is that my dog had heartworm when he was a puppy, because he's a rescue as well. And I'm just wondering what his chances are of developing a heart murmur from that.
The chances of him developing heart murmur are pretty slim. Heartworm, it's kind of a misnomer. They live in the pulmonary artery for the most part. And so it's, even though we call it heartworm, it's more of a vascular type problem for dogs. I'm glad you have your dog treated, and every year they should have a physical exam to actually listen to the heart, because depending on the breed, some breeds are more prone to getting heart murmurs than others, especially small breed dogs can have issues with that. And it is a condition that can be monitored and then treated if they start to run into some issues. And treatment right now, we've got all kinds of new drugs and things. So we have these little dogs with heart disease living much longer than we ever have in the past.
Oh, that's good to hear.
Keep an eye on things.
Right.
All right, let's go to Maureen from Clinton. Hi, Maureen. What's your question?
Oh, hi. I have a small dog. She's 7 pounds, and about a month ago I took her for her Lyme's and kennel cough. And at the time, the lady told me that she gets the same dosage as a 100-pound dog.
You got it.
That's hard to believe.
That is interesting.
And it's just like it's just like in people when we get vaccinated, the same thing. It's like a vaccine is for an immune system, and it doesn't matter what size that immune system is packaged in, whether it's a Chihuahua or a Great Dane. They get the same amount of vaccines. What we do differently for small dogs, though, is limit the number of vaccines that we give at one time. A large breed dog can handle multiple vaccinations like rabies and distemper and so on. Your small dog, I would probably be looking at doing maybe 1, maybe 2 at most at the time, because they're at a higher risk of having vaccine reactions. So we just kind of change how we handle it a little bit.
But there are some drugs that are weight dependent. And
definitely.
Heartworm
pills, flea and tick medication, antibiotics, anesthetics, everything is weight dependent. But when we're looking at the immune system, it's a very different structure than the whole body.
Jack is no longer there, so we will go to the next caller, which is Laura from Janesville. Hi, Laura.
Hello.
Hi, what's your question?
Hello.
Hi.
Go ahead.
We hear a lot about Zika virus. How is it going to affect our animal babies?
Well, that's a really good question. We don't know. And there's so much research going on right now that it's something that, we just have to wait and see what happens. And this is a good question because it's not just these oddball viruses that are showing up, but things like heartworm disease, and there's all kinds of things like that that are spread by mosquitoes. So making sure that you consider using some type of a mosquito repellent on your pet if you're in a heavy area. There are a couple of things licensed for pets to be able to use. Only on dogs, though, not on cats. There's a product that's called Advantix that has a label for repelling mosquitoes. And so that might be something to talk to your veterinarian about, especially if you're in a heavy, did I say ticks? I meant mosquitoes, but in a heavy mosquito area.
But not the human repellent.
You don't want to use human repellents because those, if you actually read the package, are meant to go on our clothing, not on our skin. And yet we apply it to our skin, but then we jump in the shower and most of us don't lick it off ourselves.
Well, speak for yourself. Let's go to Carol in Dodgeville. Hi, Carol.
Hi.
What's your question?
We have a Jack Russell, and he keeps licking his feet terribly, and I've given him Benadryl, and it doesn't really seem to help, and I'm not quite sure we should take him to the vet.
The most common reason why dogs lick their feet is because they have allergic skin disease. And the two big allergy organs for dogs are their ears and their feet. And so getting the allergies checked out would be one thing, but we also will see after they've been licking and licking that moisture will open up that foot to infections, and we'll see secondary yeast and bacterial infections. There's some very simple testing that we can do. We just spread the foot. We actually put a piece of Scotch tape on it, pull it off, and then stain the tape and look for organisms. And we have to get that under control. And sometimes that requires oral antibiotics, antifungals, daily shampoos, but there's new drugs on the market for treating allergies that are very effective. I think you've got your dog on one called Apiquil.
Apiquil, yeah.
And it's more readily available than it has been in the past. So the supply is out there, and it's very helpful for these dogs to stop that itching. And you've gone through the foot licking.
You put him on that, and he stopped itching the next day.
That's right. Very effective.
And unfortunately, as you say, there is a supply now.
There is a supply.
All right, Stanley, sorry to keep you up here, buddy. Bring him back.
We will.
He gets a little more rest.
Okay.
Oh, it's so priceless, Sandy. Congratulations.
Thank you.
Thanks for calling in, everyone. We'll be right back.